And again, let us discuss the common infectious diseases in man. Okay, so first, bacterial disease, typhoid. So what is the pathogen? Disease causing organism. Typhoid is caused by Salmonella typhi. And again, how it is transmitted, how it is infected, that is how the infection is happening in human beings. It enters the small intestine through contaminated food, contaminated water, and it enters from intestine. It enters the other organs via blood. It is transported through blood to other organs. And how long it will take for causing infection? 2 weeks, totally 2 weeks. Okay, so Salmonella typhi, which is living in contaminated food and water, it is just entering into the human intestine, and again from intestine it is reaching other organs through blood. For this process, it takes 2 weeks. Yes. So what are the symptoms of typhoid again? High fever, 39 to 40 Celsius, and severe headache, weakness, and stomach pain, constipation, no hunger feeling, loss of appetite. Okay, so all these are the symptoms. And again, even if we see that is the food, if we are affected with typhoid, we won't have that feeling of eating. Okay, that is from that we can easily identify typhoid. And again, intestinal latest, that is if it is not identified in early stages, and again no medications are given properly, that leads to intestinal perforation and death. Okay, and again this can be identified, diagnosed by Vidal test. So this question you can expect, the typhoid can be diagnosed by using Vidal test. And again, one more thing what you have to remember is Mary Malone. So her nickname is Typhoid Mary. She was a cook and she was distributing the food for many, but she was infected with typhoid, but without treatment and without knowing that, she was continuing cooking and distributing the food, and thereby she was the reason for spreading typhoid for several years. For that reason, she was nicknamed as Typhoid Mary. And how we can, that is after knowing that we are infected with Salmonella typhi, there are different types also, paratyphoid A and B, actually TAB. This is typhoid and this is paratyphoid A and paratyphoid B. And again, based on the infections, titer values they will get, based on the infections, how much organisms are accumulated in the affected person, based on that the treatment will be carried out. And again, as there is no hunger feel, the persons avoid eating and they will become very weak. So for them, again, we have to provide the liquid food, and again intravenous supply of nutrients is also needed. And the treatment by antibiotics, ampicillin and chloramphenicol. Ampicillin and chloramphenicol are the antibiotics which are used for the treatment of typhoid. So clear here what you have to remember, the pathogen which is causing typhoid, and again symptoms you have to remember, and treatment.